Everyone, it's me, Carly Burridge, founder and owner of Gaining Health, and we are back for another episode of What's Up Wednesday. So this time we're going to be talking about an opinion piece by Donna Brazil that was highlighted in the most recent OMA newsletter. So the title of this article is Obesity Treatment Can Save Thousands if Medicare Decides to Fund It. It was published in The Hill on September 16th. And in this opinion piece, the author highlights some of the statistics about obesity. We know that the numbers from 2017 to 2018 showed that 42% of US adults have obesity. And unfortunately, since the COVID pandemic, that number has only continued to increase pretty dramatically. And she also highlights the health disparities when it comes to obesity, with African Americans and Hispanics being disproportionately affected by obesity. She also reviews that the American Medical Association formally recognized obesity as a disease requiring a range of medical interventions to advance obesity treatment and prevention in 2013. So it's been a while since then, but however, unfortunately, since then, the Medicare Part D prescription drug benefit program has not changed its stance on this, and they do not cover drugs that they consider non-essential, including drugs and medications for the treatment of obesity, right? This needs to change. Obesity is a recognized medical condition. It is not a benign condition. It's not a cosmetic condition, and it's absolutely essential that we treat obesity. The National Institutes of Health reports that an estimated 300,000 people die every year in the United States from complications of obesity, making it the second leading cause of preventable deaths in the country. And we also know that obesity causes or exacerbates over 236 medical conditions, including over 13 types of cancer. And it affects quality of life and life expectancy significantly. This is a big deal, guys. This is not non-essential, right? And so recognizing the serious problem caused by Medicare's exclusion of coverage for obesity treatment, Democrats and Republicans have signed on as sponsors of the Treat and Reduce Obesity Act, also known as TROA. And it's just so important that we get this bill passed through Congress. We know especially the COVID-19 pandemic has highlighted that the obesity epidemic is making this COVID pandemic so much worse, with about 78% of people who've been hospitalized, who've been placed on a ventilator, or who have died from COVID had overweight or obesity. And again, this impacts the Blacks and Latino population especially hard because both groups are nearly 3 times as likely as whites to be hospitalized with COVID-19, and they're more than twice as likely to die from the disease. So again, this pandemic has just highlighted the obesity pandemic that we've been struggling with for years, and it really is time to take a stance here. So I'm going to share a link with you for you to learn a little bit more about TROA and what you can do to connect with your state representatives to support this bill. And it's really super easy. The Obesity Action Coalition, which is the link that I'll send you to, they have done most of the work for you. So it is so easy. Please go to this link, put in a little bit of your information, and support the Treat and Reduce Obesity Act. Okay? And just as a last note, in general, remember that the TROA is about medication coverage. So it's important for providers to recognize that medical visits for obesity are generally covered. So just bill this as you would other medical conditions. And don't forget that when you treat obesity, you're also treating the complications of obesity. So make sure to code for those as well in your visits. All right, that's all I have for today. So please go on and support the Treat and Reduce Obesity Act. And of course, if you're a healthcare provider or an organization looking to incorporate obesity medicine into your clinical practice, and you're looking for some tools, some guidance, and support, please check out gaininghealth.com, and I will see you all back next week for another episode of What's Up Wednesday. Until then, take care. Bye.